Thank you for joining in. I can see quite a few people are joining in very rapidly. That's an encouraging sign and looking forward to a fantastic presentation. So thank you. And whilst you're on the line, I'd encourage you all to think about some questions that you would like to be answered, as we've given quite a time after the presentation for the discussions. So we'll be starting in just under a minute, as giving some people time to join in, but I can already see several of you have joined in, which is really encouraging. And we're probably just about 40 seconds from the start. Right. So welcome, everyone. It's a real pleasure to be able to talk to you. I know it's a strange world. However, these webinars do bring us closer. They help to bridge the gap and also give us the chance to improve our knowledge for the betterment of our patients' pathway through their cancer journey. So the purpose is to design care experiences that get the best possible life outcomes. And in the next slide, we will be seeing that GenesisCare is providing cancer patients care across 5 countries. And in the UK, we now have 14 GenesisCare centers and more than 38,000 radiotherapy treatments provided by GenesisCare in 2018. And as you can see, they are well spread out, but what is most important and pleasing is that patients in Bristol and the surrounding areas can be offered potential for treatment for their cancer care pathway in GenesisCare in Bristol. And as we'll see in the next slide, that the facilities at GenesisCare Bristol include top range advanced radiotherapy, provision of CT scanning and PET CT scanning. And in the advanced radiotherapy, the IMRT, image guided radiotherapy, and surface guided radiotherapy, which means patients do not require a tattoo for radiotherapy. And as you know, some patients would rather avoid that. There is provision for doing stereotactic body radiotherapy, deep inspirational breath hold technique to avoid the heart in breast radiotherapy, and also partial breast radiotherapy. And it's not just a radiotherapy center, it provides systemic anti-cancer treatment with chemotherapy and immunotherapy, providing holistic therapies and living well programs. And what is most important personally to me is the exercise medicine clinics. Patients who are undergoing treatment there can access that. And I will say that many of my colleagues will vouch for this, that I perhaps would never have considered exercise medicine as a main part of my treatment algorithm. But I personally have joined that exercise medicine program to see how patients benefit from it. And I can say from personal experience that it is something very rewarding. So if you need any more information regarding the Bristol Center of GenesisCare, the email address is at the bottom for bristol.admin@nhs.net, who will provide you with the information that you require regarding that. Next slide, please. I'm Amit Bahl. I'm a consultant oncologist in University Hospitals Bristol, and I'm also the clinical director for GenesisCare Bristol. As an oncologist, my whole role is to provide care to my patients during their cancer care pathway. And I'm absolutely thrilled to have Joshila Devile, the oncology physiotherapist, who's the head of exercise medicine for GenesisCare, talking today, explaining exercise medicine, the advantages of exercise medicine and how the program works and how we can all incorporate this in our daily practice. Joshila is the head of exercise medicine for GenesisCare UK. She did her undergraduate physiotherapy degree in South Africa and is currently doing a postgraduate degree from Edith Cowan University in Western Australia. My personal experience of having liaised with her is that she's a wonderful speaker, but more importantly, a very enthusiastic and what I call a patient-friendly physiotherapist. So we'll move on to the next slide where I would like you to answer this question. And after this question, we'll see a patient's introduction to exercise medicine in a video. And this is a real patient undergoing through that experience. And then following from that, Joshila will take on and take you through her presentation. So please feel free to answer the question, how often do you recommend exercise to patients? Is it 0 to 20%? Is it 20 to 40% of the time? 40 to 60, or 60 to 80, or 80 to 100% of the time? And, you know, like with every polling question, we want to get a feel for what you in the audience think about exercise medicine. And it would be nice to get that feel so that Joshila can then take on and explain. And even if you recommend it, it's important to know what to recommend or how to discuss it with the patient. Right, that's very interesting actually. So we've got nearly half the audience who are doing it more than 80% or nearly 100% of the time. There are a few who are doing it roughly around half to 3/4 of the time, and very few actually who are not recommending it. But I think this webinar will be important for all of us, those recommending it and those not recommending it, because even when we recommend it, I personally have found it quite difficult sometimes to actually explain it in its nitty-gritty so that the patient understands it. So I look forward to the next section of the presentation.
When my oncologist recommended that I actually join the exercise program, I was extremely apprehensive, nervous about the commitment and actually participating whilst I was having my radiotherapy treatment. But it actually is now so apparent it was the best thing that I could ever have done and turned what was a really negative situation into a very positive one and life-changing, which I am truly, truly thankful for. This program helped me recover both physically and mentally. Some days I was literally exhausted and almost crawled into the gym because I was just so tired from my treatment. But by the end of the session, I was actually glowing. I came out revitalised, feeling better, energised emotionally and physically. And it was amazing change when I went in. I did suffer very sore skin breaks. So the sessions were then adapted. It was all about what I then could achieve and could do rather than, oh, I can't do that because I'm sore or whatever. Which again, that boosted my confidence. It was personalised to me and my condition. The exercise programme went way, way beyond my expectations. It taught me the importance of exercising to aid my recovery and my future health. It gave me focus to get through the radiotherapy, and it built my confidence to make the changes for a healthier lifestyle going forward. When my oncologist...
Hello, my name is Joshila Devile. I'm a physiotherapist and I am the head of exercise medicine for GenesisCare in the UK. So what is exercise medicine? Let me start with what it is not. Exercise medicine is not coming for a little bit of physiotherapy or some rehabilitation. It is actually the science and art of manipulating the principles of exercise to produce a desired physiological effect. It also encompasses the health and fitness assessment of the patient to produce a comprehensive exercise program that will help the patient get through their treatment by decreasing the side effects they experience, and also acts as an adjuvant to other treatment being received. So if you prescribe a squat to 3 different people and manipulate the principles of exercise, which are frequency, intensity, time, and type, you will get 3 different physiological effects. Exercise medicine also addresses the individual concerns around exercise. So you may have someone who used to do a lot of exercise who's now thinking of going back but doesn't know how or when to start the exercise program post-treatment or post-surgery. And in most cases, you will have someone who's a complete novice who just wants to make that positive lifestyle change after receiving their diagnosis. So why exercise medicine? We know that observational studies show increased survival outcomes with a 35 to 40% reduction in cancer-specific mortality. So this study looked at that. There were 26 studies included that showed an association between physical activity and cancer survival outcomes. And as you can see in this graph, almost all but one of the studies lies to the left of the graph. And the pooled risk reduction across all the studies was 37% when comparing the most versus the least active participants. There are also currently randomized controlled trials going on, like the challenge trial and the interval gap 4 trial, that are looking specifically at whether the exercise increases overall survival in cancer patients. And I'm optimistic that once the outcomes of these studies are published, this will influence policymakers to include exercise medicine as a vital component into cancer care. Exercise medicine acts as an adjunct to treatment. So for chemotherapy, it helps with chemotherapy completion rates. Muscle mass adds to the circulating volume of chemotherapy, thereby preventing the buildup of this drug in more perfused organs, which directly translate to greater side effects experienced. So this is referred to as the compartmentalization effect. So exercise effectively helps to widen that therapeutic window, i.e., less side effects experienced and increased tolerance of the prescribed dose. And I will elaborate further on this when I present the outcome of the PACES trial a few slides on. So in radiotherapy, the oxygen enhancement effect refers to the enhancement of therapeutic or detrimental effect of ionizing radiation due to the presence of oxygen. So oxygen abundance creates additional free radicals and increases the damage to target tissue. So in solid tumors, the inner parts become less oxygenated than normal tissue, and a higher dose is needed to achieve the same tumor control probability as in tissue with normal oxygenation. Exercise-induced tumor radiosensitization, however, remains to be confirmed in preclinical and clinical trials. There's just been a few small studies done, but nothing conclusive as yet. So there was also a study that looked to determine what the main barriers and facilitators to exercise are for cancer patients. So the main barriers to exercise are severity of side effects experienced, location of the facility, and time. And that's true for most of us, right? We don't have time to exercise. So by locating the exercise clinic within the centers and scheduling appointments to coincide with patients' treatment, that effectively removes the barriers of location and time. And what are the facilitators of exercise? Well, cancer patients require the endorsement of their oncology clinician or healthcare professional and advice from an exercise professional trained in oncology. So luckily, here at GenesisCare, we have those specialized physiotherapists and the full support from the referring clinicians who effectively prescribe the 12-week exercise program. So GenesisCare has chosen to invest in this service because offering exercise medicine is the right thing to do to ensure the long-term outcomes for our patients. So to address the main barrier to exercise, which are the side effects experienced by patients, the American College of Sports Medicine convened a roundtable in 2018. So the purpose of this was to update the original 2009 guidelines and also to evaluate all the available evidence to provide a consensus statement. So there's been a lot of evidence that have come out exponentially in the past 15 years. This was all published in 2019 as a series of 3 papers. So as you can see from this table, more studies are needed to address the side effects in column 2 and column 3. But there's strong evidence for the use of exercise in improving anxiety and depression levels, fatigue levels, which between 30 and 60% of cancer patients report as their most debilitating side effect. Quality of life and perceived physical functioning improvements, which have a knock-on effect on mental health and health perception. And there was also no risk of exacerbating lymphedema, which is one of the major obstacles to the uptake of exercise in breast cancer patients. That fear that if they exercise or use their arm, they're going to develop lymphedema. So this consensus statement, I feel, now provides the cornerstone to the development of evidence-based exercise offerings for this patient population. The BASIS trial looked at exercise during adjuvant chemotherapy in breast cancer patients. So various outcomes were looked at, like strength and physical fitness and role functioning. But amongst them, and what I wanted to highlight today, was the chemotherapy completion rates. So 230 patients were randomized into 3 groups, 2 exercising groups and 1 usual care group. So the on-track group consisted of in-clinic, moderate to high intensity resistance and aerobic training supervised by specialist physiotherapists. The OncoMove was a self-regulated, low-intensity home exercise program that consisted more of walking and support via the phone, and the usual care group who were just given advice about exercise. So as you can see from the slide, only 12% of the resistance training group needed a dose reduction, and this was compared to 34% in both the home exercise and the usual care group. The average dose reduction, however, over the 2 exercising groups was 10% compared to 25% in the usual care group. The study also did an exploratory analysis on trastuzumab or Herceptin completion rates and left ventricular ejection fractions. Only 6% of the resistance training group required delay or discontinuation of trastuzumab treatment because of reduced left ventricular ejection fraction. Then this was compared to 28% in the usual care and 24% in the home exercise training group. So patients who participated in physical exercise or in physical exercise were more likely to have returned to work at the 6-month follow-up than those in the usual care group. And this has not only financial implications, but also carries quite a lot of meaning in terms of quality of life and the sense of returning to normal. So these findings also have potentially important clinical implications in that higher chemotherapy completion rates may improve disease-free and overall survival. Now that we know that exercise is safe, feasible, and beneficial, what are the mechanisms of its action? So how does it work? So there's ongoing research in this field, looking at tumor signaling, vascular stabilization, mobilization of the natural killer cells, just to name a few. So this slide attempts to describe some of the changes that occur with acute and chronic exercise. So when you are increasingly sedentary, there's increased circulating insulin, growth and sex hormones, less efficient metabolism, and you are essentially in a pro-inflammatory state. And this creates a very favorable environment for the tumor. However, when you exercise, like go for a brisk walk or run, acute short-term changes occur. A wave of inflammatory and immunomodulatory mediators are released, almost like a dose of medicine, by the muscles, and this has a beneficial effect on the immune system. One of the mechanisms is by the recruitment and delivery of natural killer cells. So exercise also stimulates the production of natural killer cells, in addition to releasing them into your circulation. So there's also increased blood flow to the tumor, thereby increasing oxygenation, delivery of vasodilators, and increased shear stress, which is important when it comes to radiotherapy and the oxygen enhancement effect. But this lasts for the duration of the activity only, and maybe a short time after. So what happens when you exercise regularly? Longer-term changes occur, that have a lasting effect on metabolism and chronic inflammation. So these repeated waves or doses of medicine effectively change your metabolism by becoming more efficient physiologically. It increases the efficacy of the immune system's surveillance, identifying, and targeting of potentially cancerous cells, all of which have a detrimental effect on the tumor microenvironment. Your immune system is effectively primed, making it more efficient and more heightened to detecting cancer cells, hence moving your physiological set point. So what does this actually look like? This preclinical trial looked at exercise-induced immunotherapy in 4 mouse models. In this picture, epigenetic mice were injected with melanoma, which then metastasized to the lungs. So the only difference in treatment was that the exercise group were given a running wheel, which the mice could then run to their heart's content. But the exercise group showed a 61% less tumor burden than the mice that were sedentary. So there was reduced metastatic tumor size and reduced existing tumor size. The other models showed that exercise decreased the incidence and tumor size following the inoculation of a known carcinogen. And in transgenic mice, there was delayed onset of malignant tumor formation in mutation-carrying mice. And so there's nothing like a picture to paint 1,000 words. So now that we know the what, the why, and the how, let's look at how this translated into clinical practice. At GenesisCare, we offer a 12-week exercise medicine program to all our patients. And we collect baseline and post-intervention PROMs and objective assessment data. So this slide shows the quality of life data from 111 patients across all our centers that are currently offering exercise medicine. And we use the SF36 version 1 to collect the data. So as you can see, there have been improvements in every single subset of the quality of life, with the biggest improvements being shown in energy and fatigue at 68%. And 84% in health change. And this is very important. The health change one is a very important psychological aspect because patients report this improvement, and this is despite having had a cancer diagnosis. This slide looks at fatigue when I use the functional assessment of chronic illness therapy to collect that data and the hospital and anxiety and depression scale. So from our patients, there's been a 25% improvement in fatigue levels, 17% in anxiety, and 23% in depression levels. And this is my favorite slide. We measure muscle strength using the 1 repetition maximum testing. And it's so rewarding to know that, you know, over 85% of our patients show improvement in muscle strength. If you look at the leg press and the leg extension, these are very big exercises that exercise large muscle groups of the body. And over 90% of our patients show improvement in that. And that really has a knock-on effect on things like balance, activities of daily living, physical functioning. And we also know that muscle is a very good indicator of morbidity, of how well you live your older life. And this slide highlights just how much patients can improve with an exercise intervention. So now I'd like to talk about just the current exercise recommendations. So the safety of these recommendations is supported by the findings of no adverse effects of exercise after cancer. So the goal is to do physical activity or exercise regularly and try and accumulate 150 minutes of moderate physical activity per week. And those sort of activities are brisk walking or gardening or, you know, going for a slow bike ride, less than 10 miles per hour, golfing, not using a cart, or 75 minutes of vigorous activity, which includes things like running or digging in the garden or playing tennis, or combination of these two. 2 to 3 resistance training sessions a week, targeting the large muscle groups of the body, and 2 to 3 flexibility stretching sessions, so foam rolling or yoga, which tends to be quite popular with our cancer patients. So these are the ACSM guidelines, the current exercise guidelines for cancer patients. What can you as clinicians do now? So I urge you to use this framework of assess, advise, and refer. There is clear evidence that patients are more likely to exercise if their oncology clinician tells them to do so. Patients want their doctors to endorse exercise. It expresses confidence in the benefits of exercise, of regular exercise, during and after treatment. So step one is to assess, and it's two very simple questions you ask your patients. How many days during the past week have you performed physical activity where your heart beats faster and your breathing is harder than normal for 30 minutes or more? And question two, how many days during the past week have you performed physical activity to increase muscle strength, such as lifting weights? So asking your patients these two questions at every visit makes the patient realize that exercise is important enough to be followed up. It acts as key transition points to change a person's behavior because, well, if I was a patient, if the doctor keeps asking, then surely this is something important that I should be doing. The third question, would this patient be safe for exercising without medical supervision, is one that you would ask yourself. Now, just to clarify, oncology clinicians are not expected to give specific about exercise prescription, like specific resistance training regimes or equipment or progression, or to do extensive screening or triage to determine whether exercise needs to be done in a rehab setting or community setting. Basically, oncology clinicians and GPs just play a very vital role in telling the patient that it is important to exercise and pointing the patients in the right direction to make that happen. So the next step is step two, which is advise. So clinicians can advise patients to increase their physical activity if they are not meeting the recommendations outlined in the previous slide. And step three, which is refer. Find out what the local provision for exercise or rehabilitation is in your area and make that referral. To summarize, exercise medicine is offered to private patients at GenesisCare as part of their treatment package at no extra cost to the patient or their insurers. PROMs demonstrate consistent improvement across all cancer subtypes. Over 85% of our patients have shown improvements in muscle strength. And for all of you, the time is now to assess, advise, and refer your patients to local exercise services. We've got a video now just from our patient Angela, who you heard talk right at the beginning of this presentation, who's going to talk a little bit about how the exercise program felt for her 1 year post-completion.
Treatment had finished, I decided that I would join a local gym, and I thoroughly enjoy being more active, feel 100% fitter and healthier. So a year on from completing my radiotherapy, I'm now 2 stone lighter, both mentally and physically in much better shape. And I continue to make exercise, healthy eating a part of my daily life. The exercise clinic, it's just, I can't stress to you enough, it's an amazing opportunity that you're lucky to have access to. And I fully recommend, and I feel so passionate about it. Just do it, honestly, do it. Treatment had finished.
Hello everyone, I'm Joshila. You've just heard me talking for the last 20 minutes, so happy to answer any questions now.
Joshila, thank you very much. It was absolutely a brilliant talk and I really enjoyed it myself, and I'm sure the audience would have. And we've got several questions coming here, and I'll still encourage the audience to please keep on putting the questions, because we are fortunate to have Joshila to give the answers. So I'll start off from the top just because it is an important question, which is if cancer patients don't have access to private care through GenesisCare, where should they go to access exercise medicine? Can you give some hints or clues on that?
Yeah, so there are quite a few resources out there. I think I'd start mainly with finding out which of your local gyms, and they've all opened now, so do they offer any GP referral schemes that you be able to access? It's quite a nice way to access the gym, and your GP can actually refer you to it, so you can get a discount at the gym. But once you get to the leisure center or whichever facility that's offering it, and they tend to be the council-led leisure centers, they will have someone actually trained who has extra training in patients with long-term conditions who will be able to prescribe an appropriate program for you. There's also the Macmillan Move More, which is more is offered more in Scotland than it is here. I think the funding has been withdrawn a bit, but there are still some pockets of it around, so worth looking on Macmillan website. And those are places that you can go to have exercise. But if you're looking for something to do at home, Macmillan have just launched a new campaign called We Are Undefeatable. And there's quite a few resources on there as well, which you'll be able to get you started and then get you going. If you're looking online at personal trainers and that sort of thing, personal trainers that have the CAN rehab qualification in the UK, which is a level 4 qualification, so quite a robust one. They are specifically trained to rehabilitate cancer patients. So it is something to look out for, or ask your personal trainer if they have done that. And there's also other things like the pink ribbon program that's out there, and some physios have done the pink and steel course, which is also specifically cancer rehab. And don't forget your local physio department, because physios are very, very good at rehabbing people. So really, there are quite a lot of options for you to explore.
Thank you. If anybody needs any elaboration on that, then I'm sure you can put the question in. Joshila, a few questions have come in which are quite similar. So I'll try and mention the questions and you can frame your answers to them, I think, in a combined manner. So one question is asking, what specific exercises do you recommend? Is it mainly cardio? And the other question is, what other exercises are benefiting patients? And a linked question, first to answer these two questions, and then after that, I'll ask you a question which is very close to my heart, which is walking your dog with weights be a recommended exercise? I wasn't sure whether it is you, the patient walking with weights, or whether the dog was with weights. But I'm assuming it is the patient walking with weights with the dog. So if you can elaborate on the exercise regimens that you would normally consider for this group.
Okay, so it really depends on what the patient has, what treatment the patient has had, and also what side effects they've experienced, and then what is the eventual goal. So when you come to see someone like me or another health professional who is able to prescribe exercises to you, they will do a full assessment. So there's no blanket, you should be doing cardio, you should be doing strength training. I think it's a combination. So if you remember the recommendation slide, it's a sort of a combination between the two of them. So in the supervised exercise clinic like Bristol that you see behind me over there, we do quite a lot of resistance training initially. It's just to get the patient's muscle strength and just to build them up from some of the muscle mass that they have lost during their treatment. That's not to say we don't forget about the cardiovascular exercise part of it, because there are patients that we do need to concentrate on bringing up fitness and that sort of thing. So most people, and I am generalizing, but most people are very good at doing the cardiovascular side of it. So people will go for a walk, go for a run, go for a bike ride, but very few people actually concentrate on building up their muscle mass. And once you sort of go over 40, you naturally start losing muscle mass year on year. So it is quite important to do some resistance training exercise. Now, you don't have to join a gym to do that, because you could do just body weight exercises at home. And there are, if you look on the Macmillan site, there are lots of online resources that you can use for that. So it is quite important to do a combination of both. And I would recommend that. I'd just like to add here, a lot of patients like doing yoga and Pilates, and I fully endorse you to do that, because that's a combination of both strength and flexibility. And whoever says yoga is not difficult, I think they haven't gone to the right yoga class then. With regards to walking the dog with weights, yes, that's a very good way to exercise and to get maybe more out of your dog walk. The other way to do it as well is to just maybe introduce a few high intensity intervals. So what you want is you want to be able to get the physiological benefit of your exercise. So you are going out for a walk for a certain period of time. What you want is to try and get the most out of that walk. So yes, if you're wearing weights, you're increasing the work of what you're doing. But also if you add in these high intensity short bursts, you can either do it for 30 seconds or for a minute, or just give yourself a goal, like from this tree to that tree, I'm going to walk as fast as I can. That repeated elevation of your heart rate and breathing, and then recovery, and then again, after a minute or two, you elevate it again. It's that gives you the fitness over a long period of time. So yeah, it's small tweaks to whatever you're doing that makes the ultimate long-term difference. I think where most people fail at adopting exercise as part of their life, it's too much change too quickly. So it's about, oh, I have to join a gym, I have to do 45 minutes every time I go. It's really not about that. It's really about saying, I do walk my dog. So I'm walking my dog twice a day. It's generally 15 minutes each. I'm going to now tweak what I'm doing. So I'm actually getting half an hour of good exercise a day. And you haven't actually changed your normal routine. So that's the way to make the long-term changes.
Thank you. Very inspiring. And I can say that I can see the gym behind you. And believe me, I personally think that I've recovered some of my muscle strength, which I lost during the lockdown period, because we are all sitting and doing clinics and, there's very little mobility. But you touched upon this topic of some people find the change very difficult. There's an excellent question which has just come in, which says, how do you encourage patients who have never really been to a gym and are apprehensive or nervous about starting a regime? And I think that applies to me. So I'm looking to see how do you encourage that?
Yeah, so if they're coming to the center, we normally do, we use that trans-theoretical model of change to assess where they are in their exercise change behavior. And based on that, you know how to pitch the information to the person. So if someone's in the pre-contemplative phase of exercise behavior change, if you suddenly go and say, oh, well, this is what you should do, and here's the data, and let's do all of that, they will literally walk out of the assessment and never ever come back. So it is all about pitching it to the patient in a way where you know where they are to make that behavior change. So normally with a cancer diagnosis, people feel they have to now make the positive lifestyle changes, but don't know where to start. So coming to see us, we would start them off very gently. It's all about what they can achieve, as Angela said in her video, but also for me, it's what's the long-term goal? Are we actually trying to make sure they're doing the activities of daily living better, or are we actually trying to make sure they're getting through their chemotherapy, building up their muscle strength, or is this patient at the risk of falling and getting a hip fracture because of being on ADT? So it's about gently working with the patient and using quite a lot of the motivational interviewing to get through that initial phase, because once they're within the first few weeks of attending the exercise program, we manage to convert most people to exercise. So, and which is why 12 weeks is a good period to offer it a good length of time to offer it for, because it makes that positive lifestyle change, so that when they graduate out of the 12-week program, they can feel quite confident and happy to join a local gym or engage a personal trainer or just join a group where they can do some exercise.
Thank you. You know, it's almost like you're reading the questions coming in, because you're leading to the next question, which is brilliant. And this is a very specific question, and just for the audience, which might be a mixed group. This question is about patients having post-operative radiotherapy after breast cancer excision. And now, as we all know, with the fast forward trial, the radiotherapy fractionation is just for 5 days over 1 week, which is a great benefit for our patients compared to the 3-week treatment before, and prior to that, the 5-week treatment. And this question is very, very pertinent, that we know now that exercise might be beneficial. So will GenesisCare invite referring surgeons to refer to the exercise clinics before their oncology appointment to get them in the system early? Because
yes. Yeah, so we try and get them in as early as possible. So before they even start with, so on the CT planning appointment, that's when we try and do the assessment for the patient as well. So really trying to get them in as early as possible, so that they can get the full benefit of the program. And even though they're just coming for the 5 fractions, they'll still be coming for the full 12 weeks.
Right. I'm not sure whether this question will be directly answered by you or not, but if you can just shed some light on this, because they're asking, obviously being very convinced with this exercise medicine program, which is like, you know, from personal experience, I'm saying this, that it is excellent. So they're asking, is it available to self-pay patients at your center, and what would it cost them? I'm not sure whether you can answer the costing question, but whether self-pay patients can consider this is something.
So we offer it to patients who are having treatment at GenesisCare. So if you're self-paying for your treatment at GenesisCare, you get the exercise medicine as part of your treatment. If it's just to access the facility itself, we don't have that pathway open as yet. It's not something that we've completely discounted, but at the minute it is only for patients who are receiving either chemotherapy or radiotherapy at any of the GenesisCare centers.
Right, but you know, you did initially mention about the other avenues. So I think that is important to reiterate, that I believe that every patient should have that opportunity, and there are other avenues there to consider. And if not, then even the small changes that you've suggested, like, you know, if you're walking your dog for 15 minutes, make it 30 minutes. You know, there are things that can be incorporated by all of us.
Yeah, and I think I should mention here as well that it's Bristol patients are lucky in the fact that the Penny Bron Centre, which isn't open just as yet, but they do offer quite a comprehensive list of things that you can attend exercise-wise. And I'm sure now they are also offering an exercise class online. If you look on their website, they are offering some classes online for physical activity and exercise that you can access for free from the Penny Bron website.
So in relation to that, again, a question which is something that I always considered when I was a teenager, like, you know, do you recommend building muscle mass with what kind of protein diet? Do you recommend alongside this? Or is there any healthy eating program that supports this?
Yeah, so that is something we get asked quite a lot in our service. And it's something that I'm quite passionate about, because you do have to have adequate nutrition. And with our cancer patients, we do need to make sure that they're eating properly. So we've got 2 pathways at GenesisCare. We've got a pathway for healthy eating and the importance of diet and nutrition during cancer, which it's free as well, once a month course, a webinar that's run by Penny Bron, the lead nutritionist at Penny Bron. And she will offer that sort of advice for patients just looking to make that healthy lifestyle change. On the other hand, when we do assessment for patients, if we pick up any anything that makes us concerned about nutrition or absorption or something like that, or cancer cachexia, or something that we're just not quite sure just a healthy nutrition talk is going to address, we then refer to a dietitian. So as physios, we're not really qualified to give advice specifically on protein and that sort of thing, but we can advise just on healthy eating and pick up if there are any discrepancies and refer on to the correct profession as such.
Thank you. One of the simple messages that I give when I'm asked about a balanced diet, and I think everyone understands this and it resonates with everyone, is that I always say what's good for your heart is good for your cancer treatment. And almost everybody knows what's good for your heart. Whether we follow it or not is another matter, but we all certainly do know that. There are a couple of questions which are interlinked, and if you allow me, I might answer a couple of them because
Sure.
they're very clinical for cancer treatment point of view, but I'd like your views on it. So so there are a couple of few questions. One, do you use an MDT approach to ensure you don't give conflicting information to patients undergoing treatment? And then another question saying, if a patient is suitable to refer for oncological therapy who would want to benefit from exercise medicine, how do I know which surgeons or oncologists work with you? And the third question, I'll stay on for that for the last bit. But just to answer these two questions, to reassure the audience, every patient treated in GenesisCare has to have an MDT policy implemented with complete MDT compliance for that, whether that MDT takes place in the private sector or in the NHS, but they are given the information that comes from the MDT and the treatment is followed according to that. Regarding referring the patient, I'm sure you can approach your local Genesis Center on the website and plus the email that I showed you at the start, which was bristol.admin@nhs.net.uk, and you can ask for specific oncologists working with them. Generally, GenesisCare is not a surgical center, so surgeons are not usually attached, though some centers do have that for breast hub and prostate hub. Would you like to add, Joshila, anything regarding the MDT approach and specifics regarding that?
No, I think you've answered that comprehensively.
Right. So this is an interesting question. Well, they all are, but this is close to my heart in the sense that, have you found any patients have had changes in their contours due to increased exercise that has resulted in replanning for radiotherapy? Because we want to be so specific in radiotherapy. Have you ever noticed that? And once you give me your answer, I'll tell you from my experience as a clinician treating these patients what it is.
So far, no, we haven't had one of that. Yes, patients do drop weight and that sort of thing, but it's not. It's over the 12-week period, and they tend to lose more weight towards the end rather than that initial first few weeks that we're doing the exercise program. So as yet, from those 111 patients, we haven't. I mean, it's more than that. The 111 patients were still February. We haven't had a replanning of any of the treatment. So I'm sure it will come, and then but it'd be interesting.
Yeah, but remember that most of the radiotherapy is now becoming shorter in duration, which is good, which actually was one of the questions asked. And I certainly haven't seen any replanning because of change in shape for this. If anything, what you highlighted was their stability of their muscles, the strength of their muscles, I find helps the positioning of the patient be more accurate and they're more stable rather than, differences in positioning. So I think it would be an interesting observation to study, but it will probably end up showing that it reduces replanning rather than increases replanning. So a question on your 111 patients is, how long do you record PROMS data after patients have completed the exercise medicine program?
So the aim was to do it at 3, 6, and 12 months. So far, we've only done the 12 months, and then COVID has hit. So our clinics are fairly new. It's only Windsor, who's been running that's been running the longest, which is 12 months. They've been running for 12 months now actually 24 months now in July. The other centers are fairly new and they haven't even been open a year as yet.
Right. So another question that's come on diet, and I think we need to answer this because it is a slightly different question from people asking about balanced diet. And this is focusing more on what advice do you give to patients at the start? Like, what's your initial sort of dietary recommendation, or do you make that assessment, and how do you make that?
So we use a check sheet, and it's we developed it in conjunction with the lead nutritionist at Penny Brown, and it's just a tick sheet, and it gives us an idea of what the patients are eating and how they are eating. Now, with cancer patients, yes, certain cancer patients are on certain diets, but they would have already seen a dietitian before coming to see us. So that's something we always clarify beforehand. We try not to give specific nutrition advice. Yes, patients might ask about how they can make their diet healthier, but those tend to be the patients who aren't specifically on a diet that's prescribed to them by a dietitian. So yes, we do collect the data, and we do collect the data at the end to see if they've changed any of their eating habits. But any of the specific changes in diet and things, we will talk, and we never make a decision sort of just based on ourselves. We will always reach out to the correct professional.
Thank you. This is quite, something that I would have asked if I had the chance to ask you a question. And that was that, when you mention exercise to a patient, sometimes they say with a sad look on their face that regular exercise didn't prevent this from happening. So does this data about the benefits of exercise still apply to me? Because some of them have really been, regularly exercising, good diet, everything, but still get cancer. And there is always that, issue of like, what's the whole point of all this?
Yeah, so, I think that with the prevalence of it going up so much, and what is the stat now? Is it 1 in 2 or 1 in 3 people that are going to get cancer or receive a cancer diagnosis? I think that exercise just builds up your reserve, your physiological reserve. So, even if you do get a diagnosis or you've had cancer, it does build you up so that if you do have a recurrence, your body is able to deal with it in a better way. You're able to get through your treatment better. So when I talked about the chemotherapy effect and widening that therapeutic window, that is done with patients who exercise. And I've certainly found in my practice at Windsor that the patients who have done exercise throughout chemotherapy have suffered far less side effects than the ones who hadn't done as much or had really bad side effects and couldn't because of the side effects that they experienced. So I always say, just try and build up your body so that when something is thrown at you, like chemotherapy or radiotherapy or something like that, you are in a better place physiologically. Your body is stronger to just help you get through your treatment.
Thank you. Obviously very impressive presentation from you, Joshila, and some of our audience want to ask whether they can get hold of a couple of slides so that they can show the benefit to their patients, or whether you can give them the references that they can then read and talk to their patients about. So
yeah, sure. There's I've put all the references in the last slide of the presentation, and yeah, feel free to disseminate this information as much as possible, because it's important that we get our patients exercising. There's been such great results from us, and I know there's a lot of good results in research, but in clinical practice, just implementing it here in our clinics and seeing the difference it's made to people's lives, I feel it's so important that everyone does it. So very, very happy for you to share as much information as possible.
Okay. There's another question which is on a similar line to change in body shape, but this is specifically for pelvic tumors, where you ask patients to drink a certain amount of fluids to fill the bladder before they have their radiotherapy. So if they use the exercise clinic prior to radiotherapy, the question is, have you noticed any dehydration and delays in the patient filling their bladder?
So we are very kind to our prostate cancer patients who actually prefer to use the clinic after they've had their radiotherapy, because it's impossible to run on the treadmill with a full bladder. So we haven't, most of our prostate cancer patients do come to us after radiotherapy, and we are quite mindful of that. Just to increase a bit of oxygenation prior to going into radiotherapy, Sarah, one of the other physios, we're going to pilot just putting a step out in the radiotherapy subweight area, and just allow patients to step up and down for 5 minutes, just to get their pulse increase, and just to get help with perfusion and that sort of thing before going into the Linux. So we're in the process of trialing this and piloting it. And if we do see benefits, then that is something that we will then try and roll out to the other centers as well.
Thank you. And I think I will put a question, the last question, but this question brings home everything that you have talked about. And this is from a patient who says, as a patient who has been on the 12-week program, I would say it is life-changing, and every cancer patient should be offered it. The gym is a safe place after a traumatic experience. Thank you to Joshila and team. You gain confidence, strength, friendships for life after cancer. And they linked that with another question which said, what can they do after the 12-week program? Because they've massively benefited from this program. So is there a program that patients can follow once treatment have been completed to maintain their bone muscle strength, particularly with reticence of attending a gym during this pandemic? So
Yes.
firstly, it is an endorsement, absolute endorsement of what you said. And I give kudos to the lady who's put this up, because, and you know, congratulations to you for going through the treatment, for going through this exercise program, and for being an advocate for this. And this is what we need from cancer survivors.
So the whole point when you finish the exercise program with us is we try and make sure that you are independent enough to go off and join a gym and confidently use it. Now, with the pandemic that hit, no one ever saw this coming. So all the gyms were shut, which is why I think the day before lockdown happened, everything online with regards to weights and exercise bikes and all of that were sold out, and printers for some reason, because everyone was homeschooling. So there is a lot that you can do at home by just following a program. Again, I direct you to either Penny Brown or Macmillan for some of those resources. If you're an ex-GenesisCare patient, you know, feel free to contact us again, because we'll be happy to talk you through some things. With our current patients, just when the pandemic hit, we were lucky enough to launch our app. So they have access to the exercises via the app. And so they were still supported throughout the pandemic, and hopefully we'll be able to start letting them back into the clinic now from next week, now that the other gyms have opened. So I think is because you've already made the lifestyle change of attending twice a week for 12 weeks, it's about just keeping to those times and doing something physical in that time. So the research shows that you just need to do one set of 12 for each muscle group to get the benefit. And if you've been through the program, you know what I'm talking about, because we teach you all the exercises, and just try and implement that at home.
Thank you, Joshila. Brilliant. And I would like the audience to answer just the following few questions, and then we will end the seminar. I can assure you that the CPD certificates will be there for you as well after the webinar. So can we have the questions, please? So do you feel that this webinar has empowered you to discuss exercise with your patients or their carers, friends, and family? It's a simple question, yes or no. We'd like to know that. But I will say the questions that came along were really very interesting, stimulating. And when you do a webinar like this, all you want is the betterment of your patient group. So let's see the answers. Gosh, Joshila, yeah, I told the audience, you are enthusiastic. You really come across with the passion behind it, which is important. So let's go to the next question, please. If the audience can stay on just for a minute, and I admit I failed in my chair's responsibility of completing exactly on time. But the next question: following this talk, how likely are you to recommend exercise medicine? Given that I think about 46% had said that they'd recommend it 80 to 100% of the time, I'm looking for answers showing that people have benefited from the program to feel confident about recommending this. So we'll have a look at the answers as they come. Oh,
Yeah.
look at that. Yes.
Well done.
Well, and I will say that if I can change myself based on this exercise medicine program, I feel everyone can, and I don't mean it lightly. So next question, I think the next is the last one, if I'm correct. So just 30 seconds of your time. Could you please rate the quality of the content in this presentation? It helps us to make the webinars useful for you. And, it's an encouragement for us, but equally it is a learning for us to try and improve things for the future. Right, let's see the answers. Oh, wonderful. Thank you. Thank you to the audience. This will not be a webinar without you and your participation. I have to thank Joshila. I really enjoyed the talk, and I'm grateful not just from myself, but from my patient's perspective and from the audience and their patient's perspective. I'm grateful for the questions, more importantly to the patients who have put questions and comments, which is really inspiring. And thank you to GenesisCare for organizing this webinar. Thank you.
Thank you. Thanks, everybody.